The Royal Melbourne Hospital is a public hospital located in Parkville, Melbourne. The hospital is a major tertiary referral centre for outpatients and also comprises a subacute facility that hosts community therapy services. Patients in outpatient clinics are referred following discharge from inpatient care, referred by their GP or community health centre, or, less commonly, referred directly from the emergency department. Outpatient clinics do not refer out into the community. The stakeholders vary slightly between clinics as each clinic has a specialised team for the unit of care, comprising specialised doctors and allied health professionals depending on the condition. For example, a diabetes outpatient clinic team would include doctors, diabetes educators, podiatrists, and dietitians. There are 8 dietitians involved in outpatient clinics. As the clinics are run separately from one another, the dietitians rarely meet to discuss outpatient clinics. The funding for dietitians is through the government, specifically for outpatients Tier 2 activity-based funding. All clinic costs for patients are covered by Medicare. The clinics themselves take place in a number of locations. The main outpatient clinic locations are One Centre, South, and West. In each of these locations, there is a number of consulting rooms in which each health professional will see patients. During our placement, renovations were taking place, and as a consequence, the clinics were often relocated to various different wards in the hospital. The structure of each clinic varies. Patients are allocated a specific amount of time with a dietitian and other clinicians depending on the patient's needs, the complexity of their condition, and whether they are a review or a new patient. Patient appointments can be scheduled from anywhere between 15 minutes and 1 hour. Generally, patients will be booked for appointments with various professionals on the same day. It is uncommon for these appointments to run to schedule. Despite appointment times, patients will often prioritise their appointments with the medical staff, and consequently, the dietitian and other allied health appointments have to fit in around this. Most dietitians at the Royal Melbourne Hospital spend the majority of their time on the wards. These dietitians involved in outpatient clinics will generally have a half day in their week dedicated to outpatients. Dietitians follow a client-centred model of care. This is achieved by using strategies such as motivational interviewing and employing principles of the trans-theoretical model of change. The dietetic outpatient appointments take place either in person or over the phone, which is known as telehealth. As mentioned before, the dietitian is required to be flexible in terms of appointment times, as patients are often likely to leave if they are not seen immediately before or following their medical appointments. Our project focused on the evaluation and dissemination phases of the project management cycle. We administered the NDPOQ to agreeable outpatients following their appointments with the dietitian. This measured patient-reported outcome measures. Many of the questions related to client-centered care, such as improving knowledge, reducing anxiety. This will help to evaluate whether or not the client-centered care is being used and how effectively it is being used, if it is. The results of the survey help to guide the aspects of client-centered counselling that the clinicians were most and least competent in. By developing these areas, overall quality of care and consequently PROMs should improve. This, however, would need to be measured by a future study due to the nature of our project being quite short-term. Our findings were formally presented to the dietitians involved in outpatient clinics. This was a group-level dissemination and provided a targeted message. We highlighted the trends seen in results, mainly the areas in which patients are most and least satisfied. We provided suggestions on how the delivery of service could be improved to better incorporate client-centered care and consequently provide greater satisfaction for patients. A formal project report was also disseminated to our supervisors. This was a highly detailed account of the entire project. This report used academic language and included detailed analysis of the results and the conclusions drawn from these. In addition to our project, we updated some patient resources. It was requested by the dietitians that the resources be updated. This was because the current resources were too long, contained out-of-date information, and were overall too technical for the average consumer. We met with the dietitians to discuss and compare ideas for the new resource. We sourced current best practice guidelines and high-quality consumer resources. We edited and added to the resources accordingly. Several drafts were created and checked with relevant dietitians. Based on the feedback from the dietitians regarding what should be changed in the resource, the following criteria were formulated. The new resources should be relevant, engaging, and consider the SDH that influence patients. In terms of dissemination, we ran an information session with the dietitians highlighting the changes we made, and in addition to this, discussed the need for further patient evaluation, which will be followed up by the dietitian.